very pleasant good morning. It is time for Money Info, brought to you by Princeton Research. Don't forget you get that research report every Sunday night with Michael King in Las Vegas and the one and only Charles Moskowitz in New England Patriot Land up in Beantown. Hey, good morning, guys.
Good morning.
Hi, Greg.
Good morning. Good morning.
Okay, so this morning we're going to change up the format a little. Usually I'll talk about the market and the options, and frankly, we're up about 28% year to date, but I don't want to get too far into that. The fact is that at Princeton and at Money Info, we have taken great strides to bring new businesses, smaller cap companies, to the forefront. And today we have Dr. Carl Schwartz, who is in Las Vegas, who we have had on the show before for Skyline, SKLN. And the company is going through some major positive changes. And so we also have Jerry Varzel from Helomix. So, Carl, please feel free to update everybody on what's going on, and then we'll introduce Jerry.
Yeah, welcome back, Dr. Carl. How are you?
Thank you very much. I appreciate it. It's fun to be on the show, and I'm glad you've invited me back. Skyline has changed quite a bit since the last time we talked, and I like to kind of bring you up to date if I can.
You betcha. Go for it.
Since I took over in the latter part of the middle of 2016, we have basically developed and matured our sales staff. We've refined our sales approach, and we started to show results. 17 wasn't very good, but we're already really moving along in 2018. And also, we've expanded our horizons by moving into the artificial intelligence area of medicine with a 20% stake in Helomix Corporation, a major player in the field. So, and I will have Jerry Varzel, who you mentioned earlier, president of Helomix, will tell you about his company. And so, in addition, we continue to look for opportunities both in the medical instruments field and in the AI space. And so, we're excited about that. We're also going to change our symbol here coming up shortly. The new name of the company is going to be I just went blank. The artificial and precision therapeutics will be the name of our, and that was and it's better to reflect our interest in this field of artificial intelligence, and we expect to move very nicely into that.
Okay, I heard some background noise. The name of the company again
is the Precision Therapeutics.
Okay, cool. So artificial intelligence in medicine?
In medicine.
Wow.
Yes.
Oh man. Okay.
It's a big deal, and I'll let Jerry spout his stuff here in a moment because he's better informed than I am, and that's his field. But as I mentioned, Skyline's sales system has really started to move, and the Streamway system is strong. We placed 11 machines in the last 3 months after a long drought. And believe it or not, we project sales for 2018 at least 100 machines. And we are seeing interest in almost every area, and more interest we've ever seen before. So.
And Carl, just
yes.
People understand how impressive that is, what do the individual machines sell for about?
The list price is $24,900, and we vary off that considerably, Charlie, because it can be that price. It can be a discounted price based on what GPOs that we're involved with, or it can be a placement where we put the machine in and they pay us back basically in the use of the disposables. So there's many variations of that, but that is how it starts out at $24,900 is the beginning, and we go from there. So
okay,
that's why
and my point in that is the fact that the company has a market cap of just around $11 million. So contracts and sales of $24,000 or even $10,000 installations makes a major it's a major move in the company for both revenues and earnings. Just wanted people to understand that, we're talking about, as I said before, a small cap company where this kind of growth is really translated dramatically into that revenue and earnings stream.
I agree. Thank you. But also, in addition, we've just to mention, we have distributors are being hired all over the world. We have in Australia and Switzerland, and we've hired a VP of sales who will open an office in Belgium here shortly, and we'll be expanding our sales rapidly over there. And we continue to look for opportunities all the way around the world because this machine has no boundaries and no borders. It can be used anywhere by anyone. And the other part of this that I want to bring out in the sales is that a lot of these machines we put in recently have gone into very large hospital groups. So we feel that the machine will prove itself out, and then the sales will become exponential from there. Many of them are, 8, 10, 15, 20, 30 hospitals, all in the same group. So the potential for sales is very large for us, which we're very, very excited about. So from that standpoint, we also feel good. And just so you know, we found that I'm going to say, I use the term key to the kingdom, but it's kind of like, what I want to say is that we found that the true interest in our machine has come from infection control, because basically no one handles the material once our machine picks it up in the operating room. It goes directly from our machine into the drain. So therefore, none of the hospital staff has to touch it. And the leaders of infection control in all these hospitals tend to be our biggest boosters. And every other product right now requires handling, and ours does not. So we're looking to really work on this particular aspect of our machine as rapidly as we can. So with that in mind, you have any questions? I have a lot more to talk about, but that's the essence of it.
No, I think it's amazing when you start talking about. It sounds like you're really starting to network that all over the world now, which it really seems like this should be in every hospital. It's kind of a no-brainer, when you think about it. You're talking the safety of ER workers.
No question. In many hospitals, it's interesting. When we talk to the buyer about the cost of this exposure to the infectious materials, they're not aware of the cost so much because many hospitals deflect that cost to the housekeeping part of the hospital. So it really isn't part of the buyer's lexicon. He doesn't really know much about it, but it is a major issue because when there is a spill, and there are, or a stick, then at that point there's a whole protocol that has to be followed, and the insurance rates go up, and there's bad publicity and all the above that plays into this infection control. So our machine really stands tall when it comes to keeping that particular problem in the hospital at a bare minimum.
Yeah, and especially like to an HCA or a Kaiser Permanente or somebody like that has tons of hospitals, you would think that this really would be something that they would look at right away.
Yeah, when we're finding as we refined our sales approach, our people have gotten smarter. We're starting, as I said earlier, getting into these major hospital systems, and they start out slow because they want to make sure everything is okay. But almost to a system, they have found what we have that works. It does what we say it'll do, and they're excited about it. But they move slowly, so. Our projections for the year are based on a steady rise in sales as the year progresses.
Well, that sounds amazing. Charles, any more questions for Dr. Schwartz?
I'm sorry, Greg. The phone just cut
out. That's okay.
Yeah.
Any more questions for the doctor?
Well, it's not that I have more questions. It's kind of. As I started to say before, the leverage for this company to gain position and earnings and sales is just monumental. And we've discussed this before with companies that have, a limited market cap that are really beginning to play in the big leagues. And I noticed in our local news the other day about hospital groups that Partners or Neighborhood here in Massachusetts, which owns Mass General and two of the other majors, is now going to buy Mass Eye and Ear, which is a pretty major operation here. And
you bet. Yeah.
Being involved with these groups, it kind of feeds on itself. Oh, the other one was Brigham and Women's. So Brigham and Women's and Mass General and now Mass Eye and Ear will all be part of Partners Healthcare. And, so a consolidation helps also.
Wow.
One thing I didn't mention was that, hand in glove with these sales, replacements of our machine go to disposables. And many of these new hospitals we're getting into do a tremendous number of procedures. So our disposable usage will go up considerably. And also, our maintenance contracts that we're signing for generally all these new machines, which is also another source of income for us. So that we're expanding ourselves several areas that will help us. And in addition, as I mentioned that Jerry Bardell from Holomics, we have expanded. We decided that there are other areas of this business that we should be in, and we sort of looked at artificial intelligence, and then we became very interested in it. And we have since taken a position in Holomics Corporation, and they are really a fabulous company on the cutting edge. And I'll let Jerry go into detail about that. But we expect to grow that whole area rapidly. We already have some other things that we're discussing with people, which we're excited about. So there's a lot going on, and I think all of it will bode well for Skyline Medical.
That sounds amazing. Jerry, welcome aboard to Money Info. Tell us a little bit about your company.
Well, first of all, thank you all for letting me join today, and
you bet.
Excited to be on the show. Yes, we're very excited. As Carl alluded to, we have a great partner in Skyline, now Precision Therapeutics, which really moves towards where we're going in terms of healthcare. Holomics is in Pittsburgh, Pennsylvania, and we're focused on personalized medicine and precision cancer. We're a diagnostic company today that looks to improve the standard of care for both patients, both now and in the future. We have a unique business model that we're excited about, focused in precision cancer diagnostics, our boutique CRO services, and our D-Chip, which Carl alluded to, our AI-powered bioinformatics platform. So we've taken three revenue-generating verticals to really focus in on an integrated clinical contract research organization, really tailored to the patient, and we're excited about moving forward.
Jerry, what amazes me is a lot of folks don't get the whole medical community in Pittsburgh, but you are light years ahead of a lot of cities, not just the United States, but the world. I mean, that whole area is just got some amazing medical facilities.
That's a great point, and we've done a few of these companies. We've worked in this space before and been very successful. But Pittsburgh was a place not only to come back home for myself, but was really set up for this business model. And as I alluded to, we talked about precision cancer diagnostics, the boutique CRO, and the informatics platform. But when we talk about precision medicine, we talk about the patient, the clinician, and the researcher. And one of the things that you alluded to is right here in Pittsburgh, we have a unique environment. We have a top leading research side in terms of the University of Pittsburgh, one of the top in the country. We have down the road a great technology-driven university in terms of Carnegie Mellon, and we also have in the hospital side the UPMC and Highmark, the hospital systems here. So if you look at our business model and what we were looking to achieve, the landscape was perfect for us to come right here in Pittsburgh and to build this out. So that's exactly what we thought. That's exactly what we focused on, and we're happy to be here.
Well, tell us a little bit more about AI. I just can't even believe artificial intelligence in medicine. Really?
It is. It's exciting, and we can get in a little more detail about the company. But jumping ahead to the AI side, many companies today are coming to the market doing some type of AI. Correct? I mean, it's today doing genomics and AI or artificial intelligence. There's a lot of hope and hype that these AI-powered machines will cure cancer. As I look at it, in the company, artificial intelligence, machine learning, whatever you want to call it, is data-driven. And this is where this company, Holomics, is well-positioned because we already have the data to power our artificial intelligence engine. We've launched our D-chip platform, which we're excited about, and this provides a rich, a real searchable knowledge base, as I like to say, of clinical and molecular insights into multi-omic profiling of patient tumors. So, we're well positioned today. If you look at Holomics and where we were over the past 10 plus years, is the ability to grow patient-derived tumors in this lab, which is a unique differentiator. And as we know, everyone's cancer is different. So having the ability to understand the response of many different tumors, and by the way, we have tested over 149,000, which is very valuable for both pharma companies and diagnostic companies developing new drugs, as well as patient treatment.
Wow. That's amazing. So you guys are basically 10 years old then?
It's over 10 years. The company was formed way back with Dr. Paul Kornblith. We acquired the company in December of 2016 and implemented this model. And part of that, over those years, decade, basically they've brought in over 149,000 plus tumors. And I think it's important, when we talk about the foundation, which is the live cell platform, and bringing these tumors in, once again, each patient test provides a personalized roadmap. So when we talk about data, and I always define precision medicine as probably others. Precision medicine is actionable data. It's data that impacts you as an individual in your therapy going forward. So not only do we have those insights in terms of growing, if you look at it, a lot of people, it's hard to understand. We actually bring that tumor in, grow it, and test it, and have drug response outside of your body. That's about as personalized as you can get. And we've gathered that data and continue. So every day a tumor comes into into our labs, that's not only impacting that specific patient, but it's also building that database of knowledge for future innovative technologies and medicines.
Now, are you working with several cancer hospitals? How do you get these tumors?
So our original test off our live cell is our ChemoFX test, which is a chemosensitivity treatment selection test, and that's out there working with oncologists across the U.S. It's a chemotherapeutic selection for treatment for gynecological cancers. And so that's out there right now today in combination with some of our other tests. So the tumor is sent in, and basically we grow it, test it, and give the results back. So we look to continue to get that out there to more patients and continue to move forward. So the more tumors we get in, not only are we impacting those specific patients in their therapy on a personalized approach, but we're also building out that database going forward. So as many more tumors as we can get in, the more information for our bioinformatics engines that's going to provide those actionable insights and rich data that we need to go forward as we all move towards precision medicine and curing cancer.
Yeah, and we've discussed this before, Greg, from the standpoint of the number of immunotherapies that there are that are, really suited to individuals and, what they have within their own system. I'm curious, Jerry, is there any pushback at all from the HIPAA people relative to collecting all of the data, or is it anonymous data?
Well, we have both, but we also have, informed consent as we bring in that data and we get going forward. As we go forward, ultimately we want to get informed consent and move forward to make that data actionable. But on the research side, we can move forward accordingly. So I don't want to say there's been a pushback if you go right down the regulatory and the right procedures going forward.
Great.
It's important to know that we also have a test, and to clarify that, our ChemoFX test and our other molecular tests, we do run a clinical diagnostic lab. And that's why I went back earlier when I talked about the three strategic pillars that we have, that being the precision cancer diagnostics, the boutique CRO services, and our D-chip. And if y'all have a few minutes, I can maybe bring that all together as we talk about precision medicine and how that all leads to that data-driven or our D-chip platform.
Yeah, Jerry, if you can, that would be a huge help for our laymen, who most of us are listening to the show.
Well, I think y'all hit it in first of us picking Pittsburgh, but when we look at, Holomics, and we talk about those three strategic pillars, and we talk about precision medicine, we talk about three things. We talk about the patient, we talk about the clinician, and we talk about the researcher. And when you look at the patient and we look at precision diagnostics, we're tailoring that care to the patient. When we look at the clinician perspective, we're understanding the biology of the tumor and looking at wider range of tools, ultimately to impact patient outcomes. And then on the researcher side, we look at our pharma partnerships and the platform technology that we have, which is our live cell platform, looking to accelerate discovery and looking at new innovative treatments going forward. So when you look at Holomics today, from the research, our focus is to accelerate biomarker discovery, right? We're going to leverage that knowledge base, our D-chip platform, and assay services. In terms of the development side, we look at patient enrichment for clinical trials. We help move towards guiding patient selection with that informatics platform, D-chip, and clinical trial assays. And then on the commercialization side, ultimately, we will look at companion diagnostics validation, and that's a benefit from our own internal experience. So if you take precision cancer diagnostics, our CRO services, and our D-chip, you can see how it's really integrated across those three strategic pillars. And ultimately, the more data we gather that's actionable data. Data is great, numbers are great, but unless it's actionable, it needs to move forward. And that's the unique thing that Holomics brings today is, those 10 years of running that ChemoFX test, as well as other molecular tests, we bring together that molecular data, the gene variants, et cetera, with the drug response of the patient's own tumor. So that's the big differentiator. We have a lot of companies out there. You can go out and acquire omic data and build up your encyclopedia and your database. But the unique thing about Holomics is this 10-plus years of drug response data, which is very unique. And we're excited about it because, like we said earlier, every patient's tumor is unique to that individual. And the more tumors we can get in and build that encyclopedia of data, it's going to impact innovative technologies, therapies, and medicines going forward.
Now,
by the way, I would just
go ahead.
I would just add, just for a moment, that and what Jerry hasn't remarked on is he's not standing still. We're in discussions with other companies about expanding our horizons in terms of innovative technologies that are out there, and we're trying to partner with them, and I think we will. So we're not just resting on the advantages that Holomics have right now. We were looking to make that even better.
Yeah, I was just going to ask you about about the synergy.
It kind of goes
between
hand
the
in
two.
hand, as you were discussing
There you go,
before,
Charles.
Carl, about being able to catch something in a filter for your original equipment, and to become, and to deal with diagnostics on that. This is a gigantic step above and beyond that, and that's really terrific. Especially, as both you and Jerry are talking about, having the result be actionable. I mean, that's the big step.
Of course, exactly. I agree.
And I think further what Carl said is, we have a great foundation, and the key is there's additional building blocks, both from a strategic partnership and our relationships with pharma, other diagnostic companies, and of course some leading medical universities as we move forward. But there's a lot of great diagnostic tests out there that, needless to say, that are under the radar. And as we look to build this out, we have an opportunity to expand and work with those, possibly look at acquisitions and things from that nature, which is ultimately bringing more data in to be actionable going forward. So I think we're in a great time. We have a great foundation. We have a differentiated foundation that's proven, for 10-plus years. I mean, there's been a significant amount of capital that has been put into Holomics, and now with this partnership and working with Carl and Skyline, it gives us the leverage to continue to build out not only the AI side in terms of talking about data, but bringing other unique tests and services within the umbrella that are going to significantly impact that in tomorrow.
Now, are your results saleable, or that's not an issue? In other words, you get a major biopharma company who is working on, immunotherapeutics.
Yep.
Do you furnish the information for the patient, or do they actually come to you and buy an assortment of results?
That's a great question. And what the D-chip does is one of the challenges that many pharma and biopharma companies have is they lack the access to analytics and rich clinical data. It really has the depth and the relevance to make actionable insights, to support their precision medicine initiatives, whatever the therapeutic area is. And so what we have is an opportunity to assemble that. And it's not just with pharma. It could be with additional diagnostic companies that we're in talks with right now to help them sort through their data and put it on the D-chip platform. So ultimately, it would be acquired. We would sell it to our pharma and diagnostic companies as we go forward. But as we continue to build that out, that data ultimately is owned by us, and we would go forward accordingly.
Wow.
So it's a revenue generating.
Sure.
Yeah. Again, I fall back on this is essentially a $10 or $11 million market cap company that is making major strides, both fundamentally within the community that it operates, but also in the opportunity for the stock to move pretty substantially.
Yeah, and I think that's important also. As Carl talked about, Skyline or now Precision Therapeutics going forward in terms of the revenue channels. That's why it's unique when we started to talk about the strategic pillars. The precision cancer diagnostics, that's a revenue-generating pillar right now today. The CRO services is generating revenues as we go forward, and you can see how they're all integrated. Then our D-chip, which is our AI bioinformatics platform, which you just asked about, as we continue to build out that revenue streams, that will be focused on providing a secure, compliant, cloud-based analytical platform, and the revenues would come from the subscriptions to the D-chip platform, and that would come from pharma, biopharma, and diagnostics companies. So you can see how all three of those pillars are revenue generating, and they allow us to continue to build out and grow accordingly. and that's the exciting part.
So it sounds like there's really, especially with Skyline, a natural synergy with not only you guys but biopharmas as well.
Without
Yes,
a doubt.
I think so. I think more importantly is to let the public understand that we're not sitting still. We're moving forward as fast as we can, hopefully as intelligently as we can. And this is just the beginning of where we plan to be. And we're, as I said earlier, we're excited about Holomics. Yes, it is. And we're excited about our growth in Skyline after all these years. And it's we're looking forward to a good 2018. And then from there, we'll continue to grow and expand our horizons as fast as we can.
This is another one of those 10 or 15-year overnight successes.
Yes.
Right.
Yeah, seen those before. Sure. Yeah, and it's absolutely amazing. Jerry, your advisory board. I mean, obviously that would be, I would imagine, pretty important for a company like yours. Are they seasoned folks?
Yeah, they are. We've handpicked them, and it's hopefully we'll be continuing over the next months here to be adding some additional folks to the board. Today we have Dr. Paul Kornblith, who was the original founder of the company, a renowned expert. Dr. Amelia Warner, who I've known personally and is within the pharma and specimen side, is a leading top expert, has done a lot in the area. And then most recently, a colleague and a friend, I'd like to say, is Dr. Mark Melandro, who brought me back here. I've worked with him at the University of Pittsburgh and what he's done there at the Innovation Institute. He was the Vice Chancellor for Technology, was a huge success, still is going forward at the University of Pittsburgh. And now with him being handpicked, moving towards working with Chan Zuckerberg Initiative, he's on our advisory board, which is a huge win for us. I mean, what he's doing there with the Chan Zuckerberg Initiative, he's going to add significant value, and I know he's handpicked for that. But for Holomics, his insights and experience, focused in on this rich data, that we focus on patients with cancer to build out our D-chip platform, and the AAI side is going to be significant based on his expertise and his bandwidth within the market.
Yeah, and just
We're
in
excited,
case
to say the least.
just in case anybody doesn't recognize the name Chan Zuckerberg, that is from the founder of Facebook, and they are funding it with some of that stock. So, it will become much more higher profile in the days ahead.
Wow.
Without a doubt.
That's amazing. Okay. Oh, you dropped a big one there. Wow, that's incredible.
Well, I think it's important that people understand that even as a small or micro-cap company, we're talking about a company that can grow by leaps and bounds and is favored and is, involved in very public information circles.
Sure. No, I think that's absolutely amazing when you start thinking about it.
And we look to bring more. We our focus is we need to have those type of individuals because it's moving so quick. And, us having an advisory board, not just to say we have an advisory board, but one that can provide the expertise and, the out-of-box thinking, because it's moving so fast. I mean, like this call started. I mean, AI, healthcare. Not too long ago we would have been, what does AI have to do with healthcare? So, this is an initiative that there's a lot of folks, there's a lot of hype, and it's validated hype because we know data is important, but we know actionable data is what's going to drive precision medicine. So we want to have those leading experts on our team to be able to, get on a call, brainstorm, and say, how are we going to move to that next level? yesterday and stay ahead of the curve in terms of our focus on precision medicine.
See, Jerry,
and
maybe
things that are this
Go ahead, Charles.
much in the forefront, as far as the public tend to take on a life of their own. I mean, I'm not. I don't want to oversimplify it, but based on who the advisory board is and the direction that the company is taking, this, to use an online word, this can go viral very quickly.
Wow. And see, maybe you can add IBM Watson to your board. What do you think?
Yeah.
Okay. Can you talk to that little box or what? That's
That's
and I think IBM Watson and others. I mean, you can watch TV and see AI and part of the informatics run on this, or the bioinformatics, artificial intelligence. And I think Watson is known, IBM Watson, in terms of a data machine, and I'd like to say that what they're doing is exciting. They're basically putting the data together that's out there, and I want to make it clear, because I think that's important. But the ability to continue to build out with the tumors that we're bringing in, and to have that drug response data is critical. I mean, to the point that if we had these tests out there and we were just providing the data from these tests, that would be significant in the drive for curing cancer. So IBM Watson and others are there, and they're putting all this data together. I just want to be clear that we're more in the trenches, actually, tumors coming in, generating that data, and then making it actionable by putting it into our D-chip platform.
Do you have, pet university research centers around the United States helping you out?
I'm sorry, I missed that.
As far as university research centers, do you have favorites among, say, like Duke or University of Pittsburgh, whatever, that are helping you out?
Yeah, we one of the things when we acquired the company, as I alluded to, we wanted to build these relationships in our backyard. I like to look at it recruiting. You have to win the recruiting in your backyard before you can be a national and then a national contender.
Sure.
So we put one in place with the Innovation Institute at the University of Pittsburgh. So it was put in place at the beginning of the year. We continue to build that out. We look to work with others, but we have one in place with the University of Pittsburgh today.
So, obviously we're hearing so much, and people are trying to raise so much money, like the race for the cures and events like that to raise money for cancer. Obviously, ESPN and, a dear friend of mine was Jimmy V, and, they've raised a lot of money to fight cancer. How can all of these technologies get together, if you will, and keep pursuing this?
That's a great question, and I've taken a stance, as we all have watched, whether it's the NFL, sporting events, sporting teams, and everything stand up to cancer. And I think we all could say today that we're aware, and we need to continue to be aware. Now I think we really need to move those funding mechanisms to really have a meaningful impact. And so, to answer your question directly, I think that the bottom line is we need to get these technologies, these tests out there, accessible to those individuals. And, I look at our tests and other tests of getting them to the patient, because at the end of the day, it's not only focused in on providing that data as of today, but we're also gathering that encyclopedia of knowledge that I like to talk about for the future, for those innovation technologies. So I think it's a stand up to be more towards let's work together in terms of making it accessible to you, to your loved ones, to be able to have these type of tests and these type of technologies. We all talk about reimbursement. We're all companies. Everybody's revenue driven, but at the end of the day, you got to have these technologies and these tests accessible to really have a meaningful impact.
By the way,
go ahead.
I was just going to say, by the way, this to bring you back to the streamway system for a moment, some of the bigger hospitals I alluded to earlier are what they're agreeing to is to put the first machine in, and then become what they call a center of excellence, so that other hospitals can have a look at this machine and see what it's doing, and help us to promote our machine going forward. So we're excited about that as well. So it's in the same vein as Jerry's talking about, that there will be centers of excellence, and this data will be moved around and sold and expanded on, and it's an exciting time, to say the least.
Well, yeah, it sounds that way. I know for Skyline, my gosh, we were talking to you a few years back, and you had all these great ideas, and of course now they're in place and growing and growing and growing. And actually this question is really for both of you. We've got, gosh, I can't believe we've only got about another 10 minutes left in the show. But for both Carl and Jerry, where do you guys see everything in the next 5 years for both the companies?
Well, I can speak. I'll take Jerry off the hook for a moment. From my standpoint, we're just the beginning of where we want to go with this, and with Jerry's help, we expect to expand into the AI community rapidly as we can. It may not always be a purchase of some kind, an acquisition. It could be a joint venture. It could be data of some kind. It could be any way we can expand this model as rapidly as we can. And on the Streamway side, I haven't given up on that at all. We are looking to see if we can't acquire a couple smaller medical instrument companies that fit with us, so that we can expand that base as well. So when we're having our website redesigned, it'll basically be Precision Therapeutics, but there'll be two drop-down screens. One will be Skyline, the other will be our Streamway, and the other will be the Holomics. So it'll be an interesting presentation. We think it'll be really well done. But to come back to what I said earlier, this is the beginning of a great trip, and we think that we'll do very well very quickly. And Jerry?
Yeah, I would just I'd probably mirror everything Carl said. I think, we're excited, with Skyline and Carl and his executive team and board's vision to move into this space. We think there's a high growth, the ability to work with a company like Skyline, Precision Therapeutics, and their leadership team and their board that has this open-mindedness, I want to say, towards this space. I think the opportunity with what we have today in these three foundation pillars that I had mentioned, as you probably articulate or be able to look at, each of those has growth opportunities. And if we can capture, which we're moving into our new sales model as we go forward, and providing this roadmap of this, the service of tests that provide a roadmap of data for individual treatment, that's going to impact us all going forward and have a huge differentiator as we look at personalized medicine. So the opportunity for growth is huge. I think it's going to be very fast, as we all know. When we start to talk about informatics and AI, we seem to all, I hate to use this comparison, but every day you get one phone, there's the next one out next week. So if we can continue to build this out and gather this data that's useful and actionable, it's just going to be a fast track. And I think the future is very bright for two reasons. One, I think it's a great opportunity for companies and to grow rapidly. And number two, there's the human side. I think we're making a difference. I know we're making a difference. And like I said, if you look at over 10-plus years of not just Holomics, but other companies, but Holomics and talking about bringing tumors and growing tumors and impacting patients' lives. That's what we're all trying to do. We're all trying to impact cancer. We all know someone, and I think it's an exciting opportunity, and we're excited about it.
Jerry, you've
And
talked
it's also nice.
Go ahead,
It's
Charles.
also nice that we're coming off a relatively small base financially in Skyline, and there is as much as ivory tower individuals would like you to believe, there is a commercial side of all of this. I don't want to sound, too firm on that as opposed to the discovery, but they really do go hand in hand. And I think that Skyline with Holomics together, is going to be able to take advantage of that. I mean, when you really get down to it, lawyers, doctors, they're still businesses.
Yes.
And they still need capital to grow, and they still need, continued growth in order to survive. And, I think that makes it a very exciting story.
And that's exactly, our excitement of working with, with Carl and his leadership team at Skyline. Carl has taken that company and put it together and put it in a right path forward, restructuring and from that perspective. And of course, we acquired Holomics in December of 2016, and this past year we spent a significant amount of our resources and time of restructuring and getting operating costs manageable to be able to go forward with a strong foundation. So, we basically have two great companies that have a great foundation, and with Carl and his leadership moving into this CRO space in the IA space is unique because we're not coming in with a lot of baggage and we're moving forward positively.
You have mentioned a few
it's
times,
very
Jerry.
Exciting.
Yeah, you're right, Charles. Jerry, you mentioned a couple times the personalized cancer therapies. Kind of explain that just a little bit. Got a few minutes left here.
Yeah, and what we've built out with this D-chip is when I keep coming back to we have this live cell platform. So the tumors come in, we're generating data, correct, on drug response, and we're constantly building out this data, this knowledge base. So when we're going back out, it's not selling one test that we're looking at. We're selling a service side of it. We call it Precision Oncology Insights. As we go out there, we're providing back to that oncologist a roadmap. So, for example, you're getting data on that specific patient based on our chemo effects and some of the other tests that are derived, that data for that therapy. But part of D-chip is also pulling in information in that next second tier of information that provides that, I don't want to use GPS, but I guess that's a great way of looking at it. If we have to go from A to B, the GPS will say, here's the shortest route, right? But, one of the things that we know, that oncologist knows that, okay, there's also some other paths. So if you're providing them a wealth of knowledge, it's more informed for them to make that decision. So, yes, A to B is the direct path, but to that specific patient, maybe you need to make one turn and come back around based on some publications and some additional knowledge. So when we can put that GPS and that precision roadmap together, that with meaningful data, that's what's really truly going to impact that patient's therapy, that individual going forward. Hopefully that was helpful.
Yes, very much so. And, Dr. Carl, I think we just have about 3 minutes left. It sounds like these two companies together as one, the future is just awfully bright.
Well, we're excited. I can tell you that we think that I'm personally fairly aggressive, and it just took me a while to kind of get my feet planted solidly, and I think we're on our way. And meeting Jerry and his company was a good fortune for all of us. And we're looking for growth, expansion, knowledge, and value in both fields, and especially in the AI area. That's exciting, but we want to have some nice, solid income from our equipment company too. So we'll go both ways, and we expect to see great results here in this year, especially.
And the next time that we're on, we're going to have to try and figure out how we're going to protect this asset from, greedy LBO guys who want to buy it.
Oh, Charles.
Well, it is what it is. I mean, somebody sees a relatively small company like this making great strides. I mean, I've discussed this ad nauseum for the last 3 years about some of these biopharma companies that don't have a solid pipeline, but who keep their eye on very specific areas, and clearly cancer is one of those. And, when they see a company making a stride, they, offer a 200 or 300% premium for a lot of these small deals because, let's face it, $1 billion is a non-consequential deal. But when you have a company that, has a value today, let's say it went up 1,000% between now and that, it would still be 10 times smaller than what most of these deals actually are. So, that's I don't buy stocks to be taken over, but it's nice to know that as the company gets built, there will be people looking at it.
Yeah.
Very good.
How true that is. Well, boy, this hour has totally flown by, guys. And Dr. Carl Schwartz again, thank you so much for being with us again. It's been a while, and it sounds like
it has.
Skyline is just starting to explode. And the new name of the company again
is
Precision?
Precision Precision Therapeutics.
There you go. I hate
I
to stop you there.
There,
I know. You get used to one name for so long. And Jerry, keep it going at Holomics, okay?
Thank you very much, gentlemen.
Okay.
Great.
Thanks
Appreciate
to
it.
all
All
of
right.
you guys. Money Info. Wow, what a show. The future is here, folks. Get used to it. Two great companies coming together. Sounds great. WPSL. Lucy.